Let's study about warfarin versus heparin today. As a doctor, you should just know about this topic as it's a very basic thing. And in recent PG exam, a question on heparin was asked that what is the lab parameter used to monitor a patient on heparin? And the answer was aPTT. So let's just quickly finish this topic. So the most basic thing is warfarin is given orally and heparin is given subcutaneous or through IV route. The reason being heparin is a large molecule and it cannot be taken orally. If you take orally, the gut cannot break it and it cannot be absorbed by the GIT system, so it will just go waste. That is why heparin is always taken subcutaneously. Mode of action: for warfarin it inhibits vitamin K, and for heparin it activates antithrombin 3. If you want to go into detail, warfarin actually inhibits vitamin K epoxide reductase, the enzyme which helps in the synthesis of new clotting factors 2, 7, 9, 10. And when you take warfarin, it takes 4 to 5 days to act because the new synthesis of coagulation factors is stopped. So 4 to 5 days it takes for the existing factors in the body to finish off. Whereas heparin, it activates antithrombin 3. So its action is immediate. Warfarin is used as a maintenance drug in conditions like DVT, pulmonary embolism, and long-standing conditions, whereas heparin can be used in acute condition like acute coronary syndrome, acute pulmonary embolism. We as surgeons give heparin when a patient comes for us to surgery. So let's say he's taking aspirin or clopidogrel or something. We convert the patient on heparin. Usually the dose is somewhere around 2,500 to 5,000 international units BD, and this is usually used for pre-surgery prophylaxis because it can be stopped 12 to 6 hours before the surgery. Whereas if you see warfarin has to be stopped 5 days before surgery. So it's a very high yield question. In pregnancy, warfarin is absolutely contraindicated during the first half of the pregnancy because it causes something called as fetal warfarin syndrome, nasal hypoplasia and all. Whereas heparin is actually the drug of choice during pregnancy. Monitoring of warfarin is done via PT-INR. The target value is somewhere around 2 to 3. Whereas heparin, previous year question, is monitored via aPTT. Usual value is like 25 to 35 seconds, but when a patient is on heparin, the value of course increases and its range is 60 to 80. The antidote of warfarin is vitamin K and the antidote of heparin is protamine sulfate. So I hope you understood this simple but little bit confusing topic. Comment down notes if you want this very nicely written PDF of this topic, and we'll just send it to you in your DMs. So see you soon.